we are looking at this in the perspective of health, but basically the same principles apply whether you're going to conduct a nutrition project, whether it is going to be a reproductive health project, whether it is going to be a healthcare project, whether it is going to be a business project. The same concepts basically apply. Uh, the, the, there's just a slight variation. So in this session, we are going to look at a number of things. One, we basically need to understand if you're going to start a project, what do you need to do and what tools are you going to use? One of those is what you call a comprehensive needs assessment. You need to understand the situation on ground, and then you base that to write your project. So you need to have, or you need to know how to formulate project goals and objectives using the SMART criteria. And then you also need to know how to engage key stakeholders during the initiation phase of the project cycle. And then be able to communicate and present a health project initiation document to the relevant stakeholders. So these are the things that we are going to look at in this presentation. So like you already know, the project cycle has elements to do with the initiation as the first phase. You initiate, you plan, you execute, and then you monitor and close. That's the project cycle. So this is project initiation is the first phase of the project management life cycle, and this is where you make key decisions that lays a very strong foundation for a successful project. It is during this time that you clearly articulate the purpose and objectives of the project and the potential constraints, and then also identify risks and strategies of avoiding or mitigating these risks. And then it also allows you to form a solid foundation for the other phases of the project life cycle. That is the project planning phase, project implementation or execution, and then finally when you're closing the program. So it's an important phase in the project. So where do you get the ideas from for you to start this project that you want to implement? The sources are very many. You could be thinking about a problem and you want to solve it. So you want to solve it in a unique way. So you're using creativity and innovation. Or perhaps you decide to conduct what we call a literature search, or you conduct research and look for the relevant ways of solving the problem. So you can go to research journals, you can go to libraries, you can search the internet and things like that. But you can also engage with people who are being affected by the problem, talk to them, and they will perhaps give you the solutions to the problem. The other way of looking at it is, if you encounter any problem, or any difficulty, or any situation that you think should have been done better, then that is a potential area for a project. I remember my personal experience with starting Risto was when I wanted to do a short course. I felt it was a good course, but it costed about $800. So I found it difficult to pay for the course. Not because I wasn't employed, I was actually employed and getting some decent money, but getting $800 for a short course of 2 months was something extremely very costly at that moment. So I felt something needs to change. So, and then that is how Restore Institute, Restore University came into existence. Okay, so any challenge that you encounter, that is an opportunity for you uh, to generate a project idea and then be able to implement it and solve. You can also carry out a needs assessment and understand what challenges are people facing, what are the needs that are existing, and then you solve that. And then from my experience, or perhaps from uh, if you have implemented a project, so throughout the project implementation, you realize that there is a certain way, a certain problem needs to be addressed. Okay, so when you're closing, you basically, that is an opportunity for you to reflect. If you're closing a project, is an opportunity for you to reflect on what could be done in a different way. Okay, so that gives you an opportunity to generate other project ideas. The project ideas can come from anyone. If you are in a setting of an organization, they can come from the management. They tell you this is how we are going to solve this problem. Okay, or the people on ground who are implementing a project will be the one to say that there is this challenge and we think it can be solved by this strategy. So the staff can be sources of ideas. The unique thing here is that if you have an idea coming from the top management, you it has already what we call buy-in, which is that you don't need to lobby for their support for you to implement that project, because actually the idea comes from them. But when the idea comes from the lower staff, that means that you really need to convince the top management to buy in, to buy in your idea and give you the resources to implement the project that you have. But also, as you interact in conferences, in workshops, as you watch videos, as you move around your environment, there are a lot of project ideas that you can see. Moving is seeing. Moving is seeing. This is in relation to what you call benchmarking. When you move around, you see what people are doing and you will be able to get ideas from them. So benchmarking is when you deliberately move around to see what other people are doing in their projects and then get ideas and then be able to implement them. So in organizations, or as a group of people, or even as an individual, you need to be able to think about ideas. Okay, you need to be able to think about solutions to the problems that people are facing, or the solutions to the problems that you yourself is actually facing. So what are those ideation methods? You can have brainstorming sessions where you call people who are interested in solving a particular problem. Then they start sharing ideas on how that problem can be solved. It is very important that you welcome everyone's idea. The larger the idea, the better. The ideas, the better. And then you now use other techniques like what we call mind mapping or word association to spark new connections. We shall look at mind mapping later on. You can use another technique, which we call the Scamper technique. It's just it is an acronym. The S is for substitution, the C is for combine, then adapt, modify, put to another use, eliminate, and then reverse or rearrange. So for example, let us assume that there is a project that is ongoing that is trying to solve a given problem. So with substitution, you want to make sure that you want to substitute the solution or one element of the solution that is being implemented in a project with another. Okay. So if, for example, we have a problem of access to education, and then Risto is saying that we can solve that problem by online education, providing education online. For you may say, okay, instead of online, let me have what you call satellite institutions. You rotate across the whole year in the 10 states of South Sudan. Okay, so you have a calendar where you have satellite locations, and then you're basically taking the education towards the capitals of the 10 states. So you stay there for 2 months and then move to another state. So basically, you instead of using online, you're basically taking the education to people, but physically. So that is substitution. Combination is when you say, okay, fine, we are going to have online, but you're also going to have the physical bit. Okay, so you combine ideas and then you get something bigger. And then adapt, change, you're basically modifying the existing ideas to fit into the context that you have. Just a moment, let me, someone is knocking on the gate, let me come back shortly. Okay, so I'm back. So you need to, I was saying adapt. So with adapting, you just modify the existing ideas to fit into a given context. With this example, is to, when people say that we don't have, you're offering online courses, but the online courses may not be applicable in South Sudan because there is limited internet. And then you say, okay, fine, we are going to provide you with the online education, but we are going to modify the technologies that we use such that even people who are in low internet settings can access education. Okay, so you have twisted it a little bit. Still, you're using internet, but now you're taking into consideration the fact that South Sudan has internet penetration problems, and then you modify your technologies and your techniques of teaching to suit into that context. Okay, so that is adapting, and then you can also modify or alter elements. Okay, you alter elements of an idea to enhance its effectiveness. And then another strategy is to put the whatever. For example, one of the problems that we have in Juba is the mineral, the bottles for mineral water. They are littered everywhere and they are polluting the environment. So one way of solving that problem is to put the bottles for another use. Okay, so I've seen houses which are being built using mineral water bottles. Okay, So if people are building houses using mineral water bottles, it means the bottles will be removed from the environment and will be used for construction. Okay, that is putting to another use. Sometimes we have what we call redundancy. This is to say that we have unnecessary steps, or sometimes we solve a problem in a very tedious way. So sometimes we need to remove these unnecessary elements in trying to solve problems. Okay, so that is elimination. You need to eliminate unnecessary elements such that you simplify the process. This is what happens with mobile money transfer. Instead of me lining up in the bank, if I want to withdraw money from my bank, I use my phone, and then the money is got from my bank account to my mobile phone, and then I go and withdraw it, and then I buy what I want. So I don't need to go to the bank and line up and then get the money and then buy what I want. So that is elimination. Okay. So for every problem that you encounter, make sure that you think about ways in which to minimize inconvenience. Okay, you need to minimize inconvenience. This is where we are having issues to do with the e-commerce. I don't want to move from my house to go to the market and buy what I want to buy and then come back. Maybe I have limited time to do that. So people who do mobile shopping or online shopping, then they bring, you say, I want a bottle of Coca-Cola. I'm in Gurei. So they go and get it for you, and then they bring it to where you are. So they eliminate unnecessary steps. Okay, so you find people having what we call apps for buying things online. It's because they are basically using that technique of eliminating. You can reverse or rearrange the order. This also has a lot of elements that can be applied in either business or in even in health. Okay, for example, one of the issues we have in health sector is to do with drug adherence. Okay, especially for chronic conditions. HIV, hypertension, even insulin. Okay, so we have had scenarios where instead of having a patient receiving, let us say, taking 3 tablets every day, we have seen it in ARVs where someone is taking 1 tablet, but within that 1 tablet, we have about 3 drugs. It's basically rearranging the whole thing and making sure that you come up with something which can be taken once and be minimal inconvenience. So we move to the next technique, which is mind mapping, which is that you have a statement about a problem that you want to solve. And that is what we call a central concept or a problem statement. And then you start to create lines that connect that problem to other ideas that are related or subtopics. So you go on connecting the ideas from one to the other, such that you have a comprehensive visualization of what this problem is related to. And that gives you a very good understanding of how you can solve the problem. Okay, so actually writing is one of the ways that frees up your mind to be open to ideas. So that is very, very key. Now, another approach is the SWOT analysis, which is basically stands for strength, weaknesses, opportunities, and then threats. When you talk about strength, we look at the internal strength of the organization, that it has that makes it better to implement a given project. Okay, so you look at if you have been implementing an innovative project and you're the only one in the field, it means you have an advantage, an internal advantage over the others because you have ever implemented such a project. So that becomes a strength. So you have the expertise, you have the knowledge that you have gained because of the experience that you have. Internal weaknesses are termed as weaknesses. I mean, internal weaknesses are the ones we term as weaknesses, standing for W. That within the organization, you can have challenges. Could be because of limited expertise or limited management experiences and things like that. The opportunities are the things which are outside the organization that the organization can take an advantage of. So you basically capitalize on them. Okay, so the advantage that you need to exploit that are outside there. And then you have what you call threats, which are external challenges that may hinder a project's success. So sometimes the organization does not have powers over these factors because they're external. Issues like the inflation rate, political instability, these are things that organizations don't have power over, but will actually impact on the implementation of projects. So if you have an idea, you can do what you call a SWOT analysis. Look at the organization, what weaknesses does it have, and then look at its strength, look at the opportunities and the potential for it. And then you come up with a conclusion whether it is very feasible to implement that project or not. Then we have what we call design thinking. It has elements to do with empathize. This is to say that the target population should be at the center of you designing or implementing certain ideas into projects. Okay, so you need to understand their needs. You need to understand their motivations and the challenges that they actually face. And then you use that to clearly define what the problem is and then create solutions without any judgment. And then, for example, if you get a solution, you need to test that solution by creating what we call a prototype. Okay, you create a prototype and then see how the prototype will be used. What is the acceptance of the prototype? Okay, and then get the feedback about the prototype and then modify the prototype according to what people have given you. That is what you call design thinking. So you don't go with your idea and then impose it on people. You need to critically look at the needs that the target population are having, and then design the solution around what they are suggesting without you judging them. User-centered design. This is common in IT. If, for example, you want to develop an app, you want to first ask the users what they actually prefer. Okay? And then after that, you can now go and create the app. There is a project that I'm involved in. The project is going to be, we're going to generate an app. We're going to make an app for midwives to use in their work as a work aid. Okay, So for example, they get a patient who has, let us say, eclampsia. Okay, so they need to start, they need to manage this case because perhaps there is a referral is very difficult. Whatever situation it is, the midwife will have to consult their app to see how this case will be managed. Okay, so before we make that app, we need to first understand the profile of the nurses. What phones do the nurses use? Are they Android phones? Are they smartphones? If they are using, are they Android or iOS? If they are using smartphone or the button phones, if I can use that. Now, how are they using them? Do they just browse, or do they have particular apps that they are using? Or if they have those particular apps that they are using, how are they really using them? So that information will help us to be able to design the app that fits into their profile. Okay, so that is what we call user-centered design. You want to first involve, you need actually to, what we are calling co-create. They should be part of the process of the creation of the app. And then we have the Delphi technique. So for example, you could have a problem and you have multiple ways of solving this problem. So you're having hard time choosing which way to solve the problem. You can use this technique to send out questionnaires or just a few questions, not a very complicated questionnaire. Choose a few experts in the field of that problem. Ask them to give you their responses on how they can solve the problem. So if you have 5, you tell them to list. If you have 5 experts, you tell them to list, you can tell them to list 3 solutions to the problem. Now, when they send their responses, you compile and then see how are all these, the 3 ideas from each of the 5 experts, how are they matching? Which is the most proposed idea? And then by your analysis, you will now choose that, okay, this is the idea that the experts have narrowed on. So by consensus, this is what they agree upon. But if in the first round, you don't get a solution, you can still ask them again until there is a consensus that has been reached. You have seen challenges being published on media. For example, a Food and Agriculture Organization or World Food Program calling for ideas on how to solve food insecurity issues in South Sudan. Okay, so you write your ideas and send them, and then the experts will look at these ideas and say this one will work, this one will not work, and things like that. And then maybe you get a grant, and then you implement it. So that is what we call innovation challenges. I think we have quite few here in the country, but it's something that that could actually be encouraged. We want people to be able to share ideas on how to solve the problems that we are facing as a country. Okay, let me admit this. Okay. So that is what you call innovation challenges or hackathons, where you organize events, people compete with their ideas and see which one is the most creative idea, and then support their development or their implementation and then scaling up the ideas. Okay, so we have seen where all these ideas come from and what techniques you can use to come up with ideas to solve problems in the community. So how do you decide on which idea to implement and which one you cannot? The key things that limit the implementation of ideas are issues to do with resources, which are basically uh, budgetary issues and then time. And then sometimes expertise. Okay, there are some problems that, or there are some ideas that are very, very good, but you don't have the human resource to implement them. So you have the criteria of constraints. You look at the constraints and then see whether you can really implement them or not. Or you can use what you call the prioritization techniques, looking at what the ideas actually solve. There are some things which are not actually, which are not priority, and one may not devote resources to them. But you can also use the feasibility analysis, which looks at the technical aspects. Do you have the technical expertise to implement the project? Sometimes you can have a very good idea, but that idea cannot work in a given location. So you have issues to do with operational feasibility, and then of course the financial constraints. So basically, in a in the phase of initiation, project initiation, we have looked at the part of getting the ideas and how you evaluate the ideas. Now, assuming you have narrowed down on the idea that you want to turn into a project, this is basically what we are going to look at in a sequence. You need to set the project objectives, goals, conduct a feasibility study, and then come back and redefine the project scope and boundaries, identify the key stakeholders, assess the risk and strategies to manage them, and then developing the project charter. So these are the activities in the project initiation phase. So let's just look at goals. Make sure that your goal is well defined and actually is aligned with the objectives of the organization. And then you have conducted a needs analysis, and then you have prioritized the health need that needs to be addressed. And then you also need to look at the issues to do with resources and feasibility. But also, it is very important that you're solving a problem that is relevant and your project can be sustainable. So you need to get the difference between project goal, project goals, project objectives, purpose, problem statement, and then the benefits. Usually the goal is broad and is a long-term outcome, whereas the purpose can also be called the specific aim or the objective. And then the problem statement is basically expounding on the health problem that is actually being solved. And then the benefit is what will happen after the implementation of the project. So we are going to look at each of these and how to actually formulate them, because it's very, very important. When we talk about project goals, we are looking at what will happen if the project has been implemented. What will the project achieve? Okay? And then how will a good idea solve the problem? So here we have examples. You have a health project goal that states that to improve maternal and child health outcomes in a rural community by providing access to quality perinatal care, skilled birth attendance, and postnatal care. So this is broad. Okay, this is broad. So it is the goal. Now, when you go more specific, you can call them project goals or project aims. So one can be, for example, increase the percentage of women receiving perinatal care from 30% to 80% within 2 years. Ensure that skilled health professionals attend to 90% of the births in the community within the next 3 years, and then reduce maternal mortality by 50% within 5 years through timely access to emergency obstetric. Okay. So you see that these ones are very specific. You cannot reduce them any further because they actually give values, and they tell you how they actually be achieved. So this, depending on whatever template that you use, organizations have proposal templates. So they can have proposal templates that have project goals, project goal, then project goals, or they can have project goal and then project purpose, or they can have project goal and then project objectives. In whatever situation that you find yourself in, just need to know how each of those can be phrased. For objectives, they have to be very clear and concrete, and they are addressing a specific problem, and then they can be used as a yardstick to see how the project is progressing. And then it also guides on the project, the objectives guide on the selection of the activities and strategies. The objectives have to meet the SMART criteria, which is that they have to be very specific, clearly defining what is supposed to be achieved, and that they should be measurable to track progress. Okay, for example, we saw that the earlier goal was to reduce maternal mortality by 50%. So that is something that is measurable. Okay, so it is something that should also be achievable and realistic given the constraints to the project. Relevant. Okay, so they should be realigned with the project mission and contribute to the desired impact. And then they should be having a timeline. As you saw in the previous example, you saw within 2 years, within 3 years, within 5 years. That was the time-bound element. So the examples of project objectives are here. Increase the number of pregnant women receiving at least 4 antenatal care visits by 50% within the first 1 year of implementation. You can see the time frame there. Establish and strengthen referral systems to ensure that all deliveries are attended by skilled healthcare professionals within 30 minutes travel time by the end of the second year. Okay, you can see the time bound there. And then upgrade and equip health facilities to provide emergency obstetric care, including access to blood transfusion and cesarean section by the end of the third year. Okay, so that means that as you're implementing this project, you know that there is one milestone that you have to achieve, that you are going to make sure that the hospitals have what you call cesarean section beds, or there is a theater, there is blood transfusion by the third year. So you basically use the objectives to gauge that now we are in the second year, how far have you reached with this? That is very, very key. And then project purposes, which I said can be used as project goals sometimes, depending on whatever template that you're using. But basically, they should reflect the intended outcomes and benefits the project will actually achieve. They should be clear and well defined, and they should also be well aligned with the common objectives of the project. So this is very important to write this project purpose or project objectives because of one, the stakeholders are well aware of the expectations of the project and helps the project team to focus on what needs to be done. And then you can use it as a basis of evaluating success of the project. And if there is anything that needs to be changed, it is very easy for you to communicate to the stakeholders because they really understand the project value and contribution. And then you can easily win their support. So it is very important to have clear project purposes. Problem statement is now the section which provides a description of the specific challenge that is actually being solved. Okay. When you're implementing a project, you have a situation A that you want to change to situation B, which is the desired future state. For example, if you're starting a project that encourages the girls to stay in schools, it means that at the start, you may have you can say that 15% of the girls aged between 15 and 20 are in schools. But at the end of the project, you want to have at least 85% of these girls in school. Okay, so that means that the current state is 15%, but you want the future state to be 85%. So you need the problem statement should clearly articulate that. Okay, so it should be backed up by evidence. The number should be very clear. It helps the donors and other stakeholders to identify that the project is needed. The project needs to be implemented. Okay, so the problem statement is very, very key. Okay, as you work on the project purposes and project statements, make sure you engage the stakeholders, conduct your research, because the 15%, you will not know where it comes from. You need to conduct research and understand the current situation, and then explore how these problems can actually be addressed. It is always very important not to use complicated language. Use very clear, concise, and specific language to articulate the project purpose, because the people who read your proposals may not be people who are actually technical in your field. So don't make sure that you communicate in a clear manner. Still, the purpose should also meet the SMART criteria, and the stakeholder should always be engaged. Now we move to what we call the strategy, which is basically that when you have a problem that you want to address, that problem can be addressed in a number of ways. The strategy basically is one that documents how this problem will actually be addressed. But before that, you need to have to first understand what we call the project scope. The project scope is very important to have, because it clearly states where the project objectives, deliverables, requirements, and boundaries. Remember, you are constrained by time, you're constrained by resources. So the project scope should be very clear, such that you don't run a risk of going beyond what you are expected to do. Okay, so the project scope is very, very, very vital. Now, coming to the project strategy is the action plan. How are you going to achieve the objectives of the project, such that you contribute to the achievement of the broader goal? Okay, so that is the strategy. In health, we have many strategies that we can employ. Okay, you can health educate people. That means you're delivering messages on health topics, whether the communities, whether the radios, whatever channel you choose to use. Or you can choose to implement preventive measures, and this can focus on lifestyle choices that people make. Okay, and this may include screening activities. You can also choose to deliver medical services to people at a reduced fee or at free. And this actually is basically increasing access. Or you can implement a mental health support services, either by opening up a clinic or through remote consultations, or organizing what you call support groups. You can choose to engage the community such that they can participate in activities such as physical exercise, sports, and recreational programs, or engage them in projects that allow them to grow their own foods, to encourage healthy eating and social interactions. Maybe there is a problem that there is lack of adequate health data of the community. So you may implement a project that strengthens data collection for use in decision making. So those are the things, those are the strategies that you can actually use. How are you going to choose the strategy to use? It depends on the health problem that you want to address and what are its root causes. So that means that you need to analyze and understand the contributing factors, analyze the context, and then see what even the stakeholders are saying about the problem, and then about the chosen strategy. Okay? So that means that you need to really look at what the project aims to achieve and what are the best ways to achieve the objectives given the resources in terms of money, time, and then the other human resources in terms of technical, human, the personnel. Okay, and then how the evaluation and monitoring of the project outcomes will be done. So you have very many options to choose from, and then making the decision may be hard for you. For projects that are a little bit wide, or say larger projects, you may need to conduct a study to really see if the strategies that you want to use will work. So you conduct what you call feasibility studies. It's one of them. So with feasibility study, you want to see whether the solution is actually practical. The proposed solution can solve the health problem. So you conduct a feasibility study. Okay? And then we have what we call proof of concept. You can have a project idea that you want to implement, but you don't know how effective it is, whether it will actually bring out the desired change. Okay, so you have this problem with you, so you need to actually solve it. Just a minute, let me make sure I charge my laptop. Okay, so we move to proof of concept. So you have this idea, and then you want to see if it is actually effective in bringing about the change that you want. So let me use the example of the midwives app that we want to use. So instead of going with this app and then giving the midwives smartphones and things like that, we may first have to give these smartphones with this app to a few midwives and then see if the maternal health outcomes in that facility will actually improve, because of the fact that we have given them smartphones with the app. If after a period of 1 year, we look at the maternal health outcomes, we compare the maternal health outcomes with the previous years, and there is no change, it means the concept is good on paper, but is not effective. It's not bringing about the desired change. So that is a proof of concept. Okay, so we move to what you call pilot studies. So with pilot studies, you test and redefine and refine the implementation of the health project on a smaller scale. You still don't want to go full blown or full scale. You want to implement something on a smaller scale and then see how you can be able to make adjustments to fit a given situation. Okay, so in summary, we need to test ideas before we invest a lot of money in these ideas. Okay, so we conduct feasibility studies, which basically looks at the practicality, and then we perform what you call proof of concept, which looks at the technical feasibility, and then we pilot studies to evaluate implementation effectiveness. Now, after defining the project goals, objectives, and then the problem statement, and then you have analyzed the feasibility of the idea, you now write a document that contains all the things that we have talked about. So that document can be called project concept brief. Sometimes it's called a project proposal. Okay, or it can be called a project initiation document. So they are basically different words, but what they mean is the same. Okay, so it is a summary document that has the main objective, the scope, deliverables of the project. So it is a tool that you can use to communicate to key stakeholders, and you can always use it as a reference during the planning, execution, and evaluation phase. Should be concise and clear. Should have the project background, context, rationale, the project goals, outcomes, and the criteria for judging success, or basically the evaluation criteria. Okay, so it should have the budget, should have how the tasks will be performed, key milestones, the key project managers and their responsibilities, any risks and how they will be mitigated, the approach, the methodology, and then the design. Not all project concept notes or project concept briefs will have all these elements. They may vary. There's a great variation on what has to be on the project proposal. If there is an organization that has requested for people to write project proposals, it has to specify the structure of the project proposal or the project concept note. But of course, in each section, you need to know what has to go there. Okay? So when you write the project initiation document, you yourself should be in position to judge if it is a very good document or it lacks in terms of standards. Look at clarity. The document should be very clear and concise. Don't write large things. People will not read. Be clear in your writing. All aspects of the project should be covered. You should not leave out any critical information. People will not call you back. They will look at your document, it lacks the budget, they will just throw it there. Should be accurate. This is where we said that you should conduct research such that you use accurate information. Consistency in terms of formatting and terminology, and then feasibility. These are things that you yourself actually you have to look at and then see if your document meets the criteria. You need to communicate this to the key stakeholders. The proposal means nothing if you just keep it on your computer, because no one will fund a document which is just on your computer without you sharing it and then people giving you resources. So they may request you to make a presentation about your project. Make sure that you tailor the presentation according to the needs and interests of the stakeholders. Okay, this means that you can write a proposal presentation about the same idea, but you have multiple presentations for them. Okay, because if you're going to meet the ministry, it could be something else. If you're going to meet the donors, it could be something else. Still, be very clear in your articulation of the objective, scope, and expected outcomes. Use visual aids like charts and graphs, and diagrams. Make sure that you allow people to ask you questions and then provide them with clarifications. So when after the presentation, they may give you recommendations where you can adjust and then make those recommendations, make those changes and document the changes that have been made. Okay, it is very important to always ensure that the changes made are still in alignment with project objectives and requirements. So after, or not even after, all along, you have been engaging with stakeholders. From the generation of ideas to selecting the key idea that you're going to implement, to testing whether the idea can work, you still need to engage the key stakeholders. So this is what we call participatory approaches. Okay, you can use a number of strategies to achieve this, but this is actually very key because it empowers the beneficiaries, the stakeholders. It empowers them, it fosters ownership, it allows collaboration. So you want to make sure that throughout the project cycle, you use what we call participatory approaches. Don't forget the stakeholders are people who have interest in the project or who may be affected by the project. They can be the beneficiaries, it can be the government, it can be the donors, the project staff, it can be the manager, it can be the project team, project sponsor, the community itself. Okay, always engage them. You can conduct community meetings. You can have radio talk shows. You can have brainstorming sessions with them, conferences, workshops, and things like that. Make sure that you have a clear plan for engaging with the stakeholders from the word go. Then we move to the next phase, which is basically planning and analysis methods. Remember that you want to comprehensively understand what the situation is, such that you increase your chances of succeeding with the project. Okay, so you can conduct needs analysis, implementation planning studies, and then the literature reviews. Some of these we have actually talked about, but we're going to have a lot of emphasis on the needs analysis. What are needs basically? According to Bradshaw, needs can be categorized into four: normative, felt, and then expressed and cooperative needs. Okay, so what are these basically? Normative needs are defined by expert standards or norms, such as legal rights, health guidelines, and professionals. For example, the WHO has a recommendation for the doctor to patient ratio. Okay, It is set, that is a standard that has been set by an organization. And then according to, I think according to the standard sustainable development goals, maternal mortality should be reduced to below 70 per 100,000 live births. Okay, so there are standards that have been set. So if you're writing your proposal, you're going to say, according to WHO, the patient to doctor ratio is supposed to be this, but in this community X, the patient to doctor ratio is this. That's a normative need. And then you have what you call the felt need. These are subjective. What the people want, regardless of whether it is actually realistic or justified, but they just say that that is what they want. That's a felt need. And then the expressed need. This actually manifests in people's action and behavior, such as complaining about it, protesting about it, or even seeking for help about it. And then cooperative need. This is when you look at groups of people and see what the other group has and what this group has. So if you look at the 10 states of the country, which state has the greatest number of doctors compared to the other? So you can have a state which has, let us say, 500 doctors more than the other. So if you compare, the other state definitely needs more doctors, perhaps. So that is what you call cooperative needs. So you basically need to understand what need is actually existing. So you conduct a needs analysis, which can be comprehensive or a rapid assessment. Okay? So it depends on the situation. In some projects, you may actually need a rapid analysis because of the dire nature of the situation. And then the comprehensive analysis or assessment can be done later on. So the tools for analysis include SWOT, PESTEL. PESTEL basically is an acronym where P is for political, E is for economic, S is for social, T is for technological, E is for environmental, and then the L is for legal factors that influence the project. You can also conduct a risk assessment and then a stakeholder analysis. So how do you do a rapid assessment? You basically can have questionnaires, checklists, and then go and interview people. Or you can send the questionnaires online and then you collect the relevant information. Sometimes you may just ask an expert in a given field, then they will tell you what the situation is and what needs to be done. And then you prioritize on what needs to be done. Make sure that the assessment is timely, especially in the context of humanitarian situations. Make the decisions very fast, such that you can arrest the situation. If you do timely assessments, it means you're going to optimally use your resources and also make sure that the stakeholders are actually involved. Okay, so you can issues that, for example, the rates, the cattle raids that we have, where you have number of children abducted, killed, what. Those ones actually need rapid assessments and assess the extent of the damage caused and how the response will be. Okay? And then you write the report. Still, this reflects that communication is very key. So that means you should be very good at writing. So far, we have written the project initiation document, or what we call the project concept brief. And now we are also writing the needs analysis report. So after you have analyzed, or after you have conducted this analysis, you write the needs analysis report. So what are the key things that you need? Of course, before you set out to conduct the needs analysis, you must have defined the scope and objectives of the analysis. Then you collected the data, analyze it, identify where the problems are, the possible solutions, and then communicate the findings to the stakeholders to see what they can do. So basically, this report should have the executive summary, which the major findings of the analysis, the background or the contextual information, how the data was collected and analyzed, and the major findings. Then the recommendations, and then the conclusion. Attachments can be photos, can be either the question guides and things like that. But before that, you should have the reference list. This is not something that I'm going to dwell on a lot, but it is on what we had discussed earlier, where you conduct pilot studies, where you conduct feasibility studies, okay? The studies that you implement before the real project comes in. So you can have what you call implementation plan study, where you look at the project feasibility and implementation strategies. And then the feasibility studies, social impact assessment, cost benefit analysis. These are studies that you can do, but in most cases in our context, these are not actually done, because the situation is the situation is a humanitarian situation largely. Okay, so basically after the rapid assessments, then the implementation happens. So some of these studies are not actually being carried out currently, unless the project is actually very unique. Conducting research is very important, and especially in the needs analysis, it's very, very key. So you need to know where the research articles are found. I see a lot of students saying that there is no information on South Sudan. When I give assignments, people say they know information on South Sudan issues. That is not the case. It's that basically I don't know where to get this information. But this information is basically gray information, or what we call gray literature. If you want information on South Sudan nutrition, then you may need to go to the nutrition cluster portal, and then you get that information. If you want to know what different NGOs are doing, then you basically need to go specifically to their website. Okay, most of these organizations have websites that are specific to South Sudan. Okay, MSF South Sudan, find out that it has a website. Save the Children, whatever organization you think about, they have information about what they are doing. And these organizations actually do these assessments, and they have this information. So you can't say that there is no information on South Sudan. So you just basically need to know how to access this information. The other thing that you really need to know, if you're going to be very good at project writing, project proposal writing, you need to know what is happening in your field. What are people talking about? What ideas are having a lot of limelight? Okay, then you take that as an opportunity. Okay, you seize the moment, either by writing for grants or by getting ideas that try to solve the problem that is actually being discussed a lot. Okay, so that is the point here, that be a person who looks for opportunities of what is happening in a given particular moment. Now look for funds, look for money. Without money, you will not really do anything. So money is needed to fund and run the project. So you need to be very organized in identifying, applying for, and securing this funding. There are many stages involved. First of all, you need to know where the opportunities are, and then prepare for be prepared by drafting your documents, proposals, and then if you actually win the award, then you basically implement and also manage the post-award during the post-award duration, or meet the post-award requirements. So where do you get the money from? You can get money directly from the government, whether it is state government, whether it is the national government, or the local authorities. The only challenge is that at the moment in South Sudan, as an organization or as an individual, getting money from the government may be hard because of the financial situation. But in other countries, definitely, you as an individual can write a proposal, and then a government can call for people who can solve certain problems in certain communities. Okay? And then they can give you money, and then you can implement your project. So in our context, we run to donors. We run to UN agencies, UNDP, UNFPA, and even we run to non-governmental organizations. We also have philanthropic organizations or foundations that can actually give you also funds. But entities like MTN, Zain can also give money for you to implement a very impactful project. So you can get grants or tender. Grants are non-repayable funds. You are given money and then you implement the project, but you don't pay that money back. Organizations can call for what you call tender, where, just a moment, as if someone has just joined. Okay. Chol Manyang, you have your hand up. Okay, so let me go back to my presentation. So for example, you can be an organization that is providing capacity building to professionals. So there could be another organization that wants their staff to be trained in a particular field. So you compete for the tender to be able to provide this training. So you bid, and then you win the contract and then get funds. So you can get funds through grants or through competitive bidding for tenders. But in managing the funds and the tender, if you have gotten one, you should apply the ethical standards of being transparent, fair, accountable, and complying with donor requirements. Those are very important. If you manage your resources very well, you have chances of getting more resources. And that means that you have higher chances of being successful in your projects. And therefore, your organization is going to be a sustainable organization, because if you don't manage financial resources in a sustainable manner, the organization can collapse. Okay? So look for those opportunities. Where are the opportunities? Conduct research. You read. Read. Who are the potential donors to project ideas in nutrition, in health, in public health, in health education, in midwifery. Okay, you should be knowing this. There are a lot of resources that you can use. With the internet, you can contact any potential donor without using a lot of resources. You can share as many proposals as possible. So conduct research. Know what tools to use, where to search for potential donors. But don't just send proposals anyhow. Make sure that you really read the donor requirements properly. Because if you don't meet, then no one is going to read your proposal. So it will be a waste of time. Make sure that you are, when you're seeking for opportunities, your project objectives are actually in alignment with the project scope and again the organization vision and mission. Okay, so write the proposal in accordance with the donor requirements. That is in terms of formatting, in terms of, this is why I'm actually very tough with formatting your exams, because if you don't know how to format a document, you have one single document, it has font size 12, it has 14, this one is written in Times Roman, this one is in Calibri. That is not a well formatted document. So that means you're not organized. Okay, so when you're preparing the application, make sure that your document is very good, well structured, is written in good English, and clearly articulates the value of the project, the impact, and aligns with the funding requirements. Then you can submit within the deadline. Okay, yeah, that is very, very important. And then issues to do with compliance if you actually get the grant in terms of reporting. So yourself still can evaluate the potential of your proposal winning the grant or the tender. So you can look at issues to do with alignment. The donor can say that this donation, this grant is for improving the welfare of school-going children. Okay, and then for you write a proposal that is actually targeting people who are 30 and above. It's not aligned, so they will just throw it away. They will look at another document. Feasibility, in terms of whether the project design, timeline, and budget is actually feasible. And then sustainability, the long-term impact and financial viability, organizational capacity. Have you ever implemented a similar project, or it is going to be your first project and it is a cumbersome one? Those are key things to note. Write a very good budget, because most likely the donor, after looking at your problem statement, objectives, and scope, they may rush directly to the budget. So the budget should be still realistic and should involve the costs associated with personnel, suppliers or supplies, equipment, and training and evaluation. And then also make sure you include a contingency fund for unexpected expenses. So we shall look at budgeting in projects in another session, but basically those are things that you need to have in mind. Monitoring of the grant is very important. You need to keep monitoring this such that you are in line in terms of expenditures and also project performance. You need to make sure that the project is successful, but if there are signs of failure, you need to identify them earlier such that you can correct any deviations. The donors will need to report, and their reporting will also depend according to their requirements. Always make sure you highlight the achievements and the challenges and the lessons learned. Collect data to demonstrate that you have created impact with your project. So data collection is very key. Manage risks. You don't want to play around with people's money. If there are issues that can bring risk issues, always communicate to them in time. You don't want the finance manager to run away with the money. You don't want to say that the money was taken away from the office. Okay, that's why we have security companies in South Sudan for all these organizations, because you don't want to have donor money in the office and then thieves come and take it. Communication is very key in issues to do with risks and challenges. Things may not be smooth, but clear communication can solve a lot of issues. And then overall, make sure that you comply to the professional ethical principles, and also making sure that you comply with the legal issues. You don't want to implement a project that is against the law, and you also don't want to breach people's contracts. So be ethical. Continuously engage the donors and improve on situations based on what the stakeholders tell you. So that marks the end of this presentation. I know it has been a long one, but I hope you have learned